All right, again, welcome to the Graduate Diploma in Midwifery information session. Thank you for taking the time out of your evening to join us to learn more about this course. I'd now like to hand over to Loretta Musgrave and Kelly Lennon, who are our presenters tonight. Loretta, and Kelly, would you like to introduce yourselves?
Yeah, sure. Thanks, James. So as James said, my name is Loretta and I'm the Program Director for the Graduate Diploma of Midwifery here at UTS. Very excited to be speaking to you about our newly accredited course. We've just been re-accredited and we are rolling out our new curriculum this year. I've been a midwife for 22 years and previously I was a registered nurse. I still do hold my registered nursing and so I have dual registration. About 3 years ago, I joined the UTS crowd here and began my journey as an academic because I'm very passionate about education. So I've had a good 25 years of experience working in New South Wales Health. And as I said, most of that has been midwifery. My focus of my work has been looking after women who are considered low risk. And I've been catching babies, over 1,000 babies in my career, in models of care which are driven by midwives. And so I'm very passionate about continuity of midwifery care, which you do find out quite a bit about in our course. And Kelly, would you like to introduce yourself?
Thanks, Loretta, and thanks, James, for the invitation to meet with you all tonight and share some of the exciting news about becoming a midwife. So like Loretta, I'm a midwife as well and a nurse. I've been a midwife for 30 years this year, which I can't believe how quickly time flies. And the majority of my working career has been up here in Hunter, New England and Central Coast, so northern New South Wales area. I have been a manager in midwifery for probably about the last 10 to 15 years and managing models of care and MGP. And my passion in my current job, which I should let you know, my current job is working in the Nursing and Midwifery Office at the Ministry of Health. I've the pleasure of being the Midwifery Advisor for New South Wales Health, which I feel very fortunate to be about. It is around supporting our future midwifery workforce and the profession of midwifery. So my passion, like Loretta, is around continuity of care, but from a perspective of how we can support our midwives to work in continuity of care. So thanks, Loretta.
Thanks, Kelly. So this evening we're going to be covering all of the vital bits of information that you need to be able to come on board with us here at UTS and start your midwifery career. So we're going to be covering the course outline, which, as I said, is a new curriculum. We'll be talking to Kelly about Mid-Start. I'll go over some of our partner hospitals and our clinical partners. I'll talk a little bit about the learning methods that we use here at UTS and the support that we provide. And then what everyone wants to know, how much all of this is going to cost and how do you apply? And then we'll follow that up with a Q&A. So the Graduate Diploma of Midwifery is a postgraduate course, so you do need to have done a registered nursing course here in Australia. We don't actually take overseas applicants into the course because we do, want you to be able to register as a midwife after you have completed our 15-month course. So what is the difference between being a midwife and a nurse? Well, huge amounts. So you're probably very familiar with patient-centred care. So here in midwifery, we're going to shift your focus to family-centred and woman-centred care. So same sort of, components, but very much focused on the woman. And midwife actually means with woman. So the course is very much focused around the woman and her baby and family. The course, as I said, is sort of 14 to 15 months, and we do actually start it in December. So we have a pre semester online course to get you ready before you start your clinical work. So that pre-semester subject we have, and then we have 4 subjects in the autumn session and then 4 in the spring, so broken into just those 2 semesters. So in order to be able to be accepted into the course, you have a job as a student midwife, and Kelly's going to talk to you about the mid-start process, and I'll talk a little bit about other options. So the course is actually, as I said, the whole time, so that 14 to 15 months, and you will be working in your clinical area or your job, so your paid job, for about 52 weeks, and you'll be working 32 hours per week. So what that comes down to is you'll be working 4 days, and then you'll have 1 day here at university. And here at university, that's usually a Thursday. And we've got some really exciting new subjects that we are embarking on this year. We have clinical subjects, and we also have theory-based subjects. So it's a real mix, and we use a variety of strategies to teach you, and we focus really on that lifelong learning. So these are just an example of some of our clinical partners. So these are all through New South Wales Health. So we have very strong partnerships academically through research, and Kelly is we're working very closely together on a project at the moment. So we have very strong connections, which is really great to translate the learnings here at university into the clinical placement. So as you can see, areas, lots of hospitals all over Sydney, and we also do have connections and there's partnerships with private hospitals as well. Just a bit of a touching on the subjects that we do. So we look at, like you do in nursing, very holistically at the woman and her family and baby. So we cover midwifery as a primary healthcare strategy, and that is actually an online, that's that pre-semester subject that you do. So we do use a blended approach here, so you will have online learning, and you will also have face-to-face learning, and we use a variety of strategies to teach you through those 2 mediums. So every semester, so the 2 semesters, we have a clinical subject where we teach you all of the practical skills that you do need in order to register as a midwife. And in doing your clinical experience, you are sort of precepted and mentored through those skills at your hospital placements. And we also do have simulation labs so that you can practice those skills before you even get out there. Because this is a postgraduate course, we have some research. So we have a fantastic research subject, which is all very relevant to what you're doing. So everything that you learn in this course will be able to be translated into your practice. We have just added a whole subject on breastfeeding, because we know that breastfeeding is so important for mothers and babies, and the benefits outweigh not doing it. So we have a whole subject, and again, lots of online learning, but also lots of practical experience. We here at UTS believe in supporting Aboriginal and Torres Strait Islander women, and we have included a whole subject, and that's a really important subject for us to be doing, and you'll really, really enjoy it. We have some fantastic facilitators. MidPrac 2 is following on, and that's more of a practical subject about the complexities of pregnancy and birth. And that is sort of buddied with another subject called Midwifery in Complex Situations. We talk about power politics and midwifery. So you're probably always hearing, something about the midwives, being advocating for women and asking for more agency around childbirth, this is where we're going to talk to you about your role as a midwife and doing those things to empower women. And we also have a subject on perinatal mental health, again, such an important issue for all women, particularly for women who are of childbearing age. So how will we learn? So we've got lots of different ways that we learn at university. So we have a really supportive team here. We're only a small team here at UTS. We only have 6 full-time staff, but we have amazing tutors that will come to you from the clinical areas. So when we're teaching about breastfeeding, we have lactation consultants that come and teach you. When we're talking about normal birth, we have midwives who are catching babies every second day in the clinical areas. When we're talking about perinatal mental health, we have a fantastic midwife who comes and talks about how to care for women when they're at their most vulnerable, and about anxiety and depression. And with all of these clinical experts, they bring with them amazing stories that you can learn from. So midwifery is really good at learning from stories. So that's a way that we teach. So we do have a really flexible and blended learning approach using adult learning principles. And we have a really great underpinning with support here at UTS. So we have student services, and we have lots of learning support as well. So we have a fantastic library and lots of different workshops that can help support your assignment writing and anything that you need here. So that's the university. We also, have the hospital component. So in the hospital, as you would know, they're very busy places, but we have dedicated educators and facilitators that will be there to look after you guys and make sure that you get through your program. There is a lot of work to do in this 15 months. And in fact, we've got a whole portfolio that you'll need to fill out. So in order to register as a midwife, you'll need to fill out the portfolio, and that includes things like catching babies, assisting with breastfeeding, doing postnatal checks, assisting mothers with their mother care skills, doing perineal repairs. So we've got a whole heap of skills that you need to take with you into the workforce. And you'll be supported to do those skills in the clinical area and fill out that portfolio. So as I said, we're really well connected, and we do have that support to get you. So here are just some examples of some of our facilities here at UTS. We have these fantastic labs, and as you can see, there's a mannequin in the bed there. So we do have mannequins that have babies in their tummies. So we can take you through the skills of palpation and even vaginal delivery with our mannequins. They're quite amazing. You can even take heart rates, blood pressures, and do all sorts of interesting things. And in that picture, you can just see in the corner, there's a bathtub. So we also simulate the birth environment. So as Kelly and I have just said, we're very focused on low risk and midwifery models of care. So there's a huge focus of that in our laboratories as well. Our sim setting is not just set up like a hospital, it's set up how a home birth might be. We do some classroom teaching, but we're moving really towards doing online learning and then coming in and making the most of your time when you're here in university. So there will be pre-reading, there will be case studies, there are podcasts that you may need to listen to, there are PowerPoint presentations. Using the Canvas platform, we have a whole heap of multimedia resources that you will use. And then when you come into university, we use that time to do collaborative work and to really use adult learning and critical thinking skills, which you will need for your career. So lots of fantastic environments for you to learn in, and some very skilled teachers. So all of us here in our midwifery team have either a diploma of education or I've got a master's of education. So we're very well versed in how to educate from a health perspective. So as I said, we do like to engage your critical thinking mind, which you will need. And we do use a lot of real life situations, lots of storytelling, case studies, and really activating your prior knowledge from nursing and taking it that next level. So we all learn from each other. I'm learning heaps from the students every single day that I come into contact. And we're all here to learn about how we can better support women and how to empower women to have the best birth that they can. So you will hear a lot about how we do that, and also the passion that we have in our team to go further and make the changes that we want to the system. So there's a lot of advocacy in what we do here, and we like to prime you to be the midwives of the future who will make changes in how women have or receive maternity services. So like any other university degree, there is some component of assessment which is probably a little bit of a sore point for some people. You know, no one likes to have exams, but the good news is that we don't have a lot of exams here. It's a practical degree, really. So a lot of your assessments will be OSCEs or Vivas, which you may have had in nursing. So testing your practical skills so that you're a safe practitioner. We also do use our Canvas site to do online quizzes, and we have a whole heap of different multimedia resources, as I said, that we use for assessment. So very much based in case studies, and we do some group work, but we really like you guys to think outside the square and use your critical thinking and adult learning. So lots of different assessments. You're not just coming in to do exams, you know, in the old hall. That's not how we do university anymore. That's not the best way to test how you're going to go in the real situation. So we use real life assessments as well. So that's it from me. So Kelly, I'd like to hand over to you and you can chat more about MidStart.
Thanks, Loretta. Okay, well, welcome. What I didn't say earlier on is a career in midwifery is the most rewarding career you could ever possibly consider. So I would encourage you 150% to go down this pathway. I've had such a wonderful career being a midwife and a nurse, but midwifery fills my cup hugely. So what I want to talk about is the MidStart process. So you would know that you probably would know there's two pathways to become a midwife. You can either do an undergraduate bachelor in midwifery, as you did with nursing, to become a registered nurse, or there is the second pathway of doing a postgraduate midwifery program, which you're learning about today, and that is specifically for registered nurses. And as Loretta mentioned, you need to have, it's a two-part process of having an enrolment in a university and an employed student midwife position. So what I'm going to talk about is the midwife student position and the process to be able to get one of those. So we call that MidStart in New South Wales, and the Nursing and Midwifery Office at the Ministry coordinates the centralised recruitment process for this. It's an annual recruitment process. Unlike your grad start, if you're a fairly new registered nurse, To get into the New South Wales system, you apply through Grad Start, and you can only do that once the year after you graduate. Mid Start, you can apply as many times as you choose. And if you don't get in, you can apply again. I guess that's the thing I'm trying to point out. So what I did before I, thank you. Thanks, James. I didn't know if you were going to do this or if, thank you. So what I specifically wanted to talk to you about are some of the tools that NAMO, the Nursing Midwifery Office, has put together to support you in being able to put in your application and apply. So we call it a toolkit. We update this every year. We've recently just updated all of the information on the Nursing and Midwifery website, which the address is there, but I had a few challenges, technical challenges, sending my slides over to James. So what I'll do when I'm finished is pop the link into the chat box so it's there for you. But if you go to the Nursing and Midwifery website, all of these tools are there. So I thought I'd just go through some of those tools for you. I think that's about it for that page, James. So to start with the Mid-Start Handbook, so the 2023, I know we're in 2022 now, but what you'll be doing is applying for the 2023 position. So we always call it the 2023 or the next year. Sounds a little confusing, but it's updated each year for next year. And the lovely Cindy, who is one of our mentoring in midwifery facilitators, was awarded Midwife of the Year a couple of years ago. So all of the photos that you see in the Mid-Start Handbook are of real midwives working in New South Wales Health. Let me just see. So in the toolkit, as I mentioned, it's updated every year. I would really encourage you to go back and have a look at it. It gives you all of the important information that you'll need, but also go back to the website, because if, touch wood, we have some disruptions this year with COVID like we did last year, we always put the updates to the process for Mid-Start application on our website. But as James says here, page 3 are the key dates that you need to be really mindful of. So we open our applications on the 24th of May via the website. So if you get on, have a look, you'll see exactly where to jump on and apply. Applications close at 4 p.m. on Wednesday, the 8th of June this year. And you'll be invited to interview on Monday, the 20th of June. There are links, you do this all via the Rob portal, and there are links that are sent to you periodically for you to be able to accept your interview or decline your interview. This year, the local health districts, who are the employers, they will be holding the interviews between the 4th of July and the 15th of July. So you'll need to be available at one point during that, and that's set at the local health district level. And I'll talk a little bit more in a sec about your interviews and where you might have that, but that is the window period that the districts, the hospitals, have given us for the interviews this year. Outcomes for the interviews, outcomes of the interviews will be emailed to you on Monday, the 22nd of August. And you'll need to accept or decline your offer if you are given an offer for a position by Friday, the 26th of August. Now, the reason that that is so important is because the local health districts then need to go ahead and do all the processing of the enrolment and, the application and employment, so that they can send you your contract by Friday, the 30th of September. Now, the reason why that is so important is because that is the document that you need to finalise your enrolment at the university. So I will talk in a couple of slides about what you need to do to download that information. But yeah, it is your contract of employment that you need to secure your university placement. I know Loretta did mention it, but I just want to reinforce that your enrolment at university and your application to Mid-Start are two separate processes, and it's really up to you to complete both of those fully. Now, oh good, I was going to say, I'm not sure if James is back. Now, if you've got a current position in New South Wales Health, you will be familiar with the ROB portal, which is the recruitment portal. That is where you we process your application form. So we've got some modules on our webpage that helps talk you through the technicalities of applying online. This link is also on our webpage, but that link will take you directly to the career portal video and just help step you through how to apply online. So there's a couple of key things that you need to remember. As I mentioned before, it is your contract that you'll receive if you get a position that you need to be able to complete your enrolment at university. Loretta can talk to this later. I think you can go on and start your application early, your enrolment process earlier, but it's not until you've got proof or evidence of a position, an employment position, that you can finalise your enrolment. I'll finish this, Loretta, and then I'll let you just reinforce that bit. So I guess the important thing for this is there are instructions on how to preview and print your contract, and then you can be able to submit that to the university. You've got to preview and print it before you accept it, which is a little bit backwards, but there is some information on the link here for you to go in and have a look, because once you've accepted it, it goes off into the world of IT, and then you can't actually go back into ROB to print that off. If you forget to do that, or you rush through and you know, somehow miss it, which is fine, your coordinator at the local health district that you are offered a position, so the Mid-Start coordinator, will be able to go back in and access that for you. But if you can, it's really important when you get your contract of employment, to have a look through that. Make sure it's all right, make sure it's at the hospital that you want to work at, make sure that it's, you know, the FTE that you want to work at, that's got all your correct details, and then print it off and then accept it, and then you've got something to submit to UTS. Now, we've got quite, I think there's about 3 pages between page 11 and 13. I know that's a bit blurry on this slide, but we have quite common questions and facts and answers for some of these questions that we've been asked over the years. So if you're not sure of something, have a look on these pages. Probably the answer is there. If not, feel free to reach out to me in the Ministry of Health, Loretta, any of your local midwifery or even nursing leaders at your local hospital are really familiar with helping people to be able to navigate through this process. But yeah, there are 3 pages worth of questions and answers that might be helpful for you. But lastly, I guess there's a few tips that I can share. The recruitment, so the Mid-Start recruitment process is really quite competitive. It is an amazing career to enter into. So putting in your best application is giving you your best chance at becoming a successful candidate. I'd really encourage you to jump onto the website and explore the hospitals that you are considering that you may want to work at. Loretta had the list that the UTS partnership with. So during your application process, you'll be asked to nominate up to 6 hospitals, which is what we call preferences. I'd encourage you to explore them, give yourself the best chance of being successful, and be fairly flexible in what you put down as your preferences. You must, and this sounds really silly, but you must be really careful with the attention to detail. It's important that you put your correct name into the application. I know that sounds really silly, but that is actually how the local health districts will find you, and you'll be surprised at how many times we don't actually go in and enter the details correctly. and submit it. There is a button at the end that asks you to submit your application, and you will receive an email that confirms that you've submitted it. So make sure once you finish your application and you submit it, you do have up until the closing date to review and finesse your application. But once you've submitted it, you will receive an email to sort of confirm that you've submitted it. Once the closing date has happened, we do not accept any late applications. So be very careful and mindful of the closing date. That's it for me, I think. Thanks, Loretta.
Thanks, Kelly. So back to me, and we have a huge amount of support for you to get through this process, but also when you do come to UTS. So I did touch on these before, and I think, as Kelly said, it is really important to get on not just the MidStart site and have a look at all the resources, but also to get onto UTS. And if you just put into the search midwifery, you will come through to the postgraduate course, and it will give you all of the details in regards to when to apply and what you will need to do that. So another really useful resource for any questions that you do have about the university side of midwifery is the Student Centre. They have a lot of information that they can give you in regards to applying, and if they don't know the answer, they will redirect you to someone who can help you. So how much does it cost? Well, we do have Commonwealth supported places, which is fantastic to hear. And if you are lucky enough to get one of those, the cost is substantially reduced, your out of pocket. So, for example, you can see there that the cost per subject is about $498, which is pretty amazing for a postgraduate course. And times that by 9, and there you've got your total costs. The fees will be updated in October, so you can have a look at those on the website when they come through, and you can also look at the UTS fee calculator. There are a huge amount of scholarships for you guys to also look at. So the New South Wales Ministry of Health have some great scholarships, and there's also the New South Wales Nurses Association. And if you're really keen, you can look at the Australian College of Midwives as well. They always have lots of scholarships going as well. So for a quick stop to have a look at all the postgraduate scholarships, do go to the uts.edu website down there, and you'll see all the scholarships and prizes that we currently offer here at UTS. There is some fee support for those who don't get the Commonwealth supported place or are struggling to pay the $500. You can get HETS help, and you can look at how this works through Study Assist, and the website is the best to go to get all the latest information around the HETS help. So do have a look at that. Very similar to what you would have experienced with your undergraduate nursing. So how do you apply? So we've heard all about MidStart, so that's really important to get going in April. We're a little bit more open here at UTS, but we would like you to go as soon as you think that this is a career for you to that site at the top, uts.edu.au PG apply. So the applications for this course are open from July, and they will close on the 31st of October. So it is really important to keep those two things in mind. So not just the MidStart, but the dates also for the university. So important information. So you do need to have a letter of offer to be accepted into the university. We can't take you if you don't have anywhere to do your clinical, unfortunately. As I said, there are some private hospitals, so not just the Mid-Start program, but there are some private hospitals. And if you are interested specifically in going to a private hospital, you can email me and I'll give you my email address and I can talk you through what some of the pros and cons and what your needs are in regards to your clinical placement. Yeah, so I think that's kind of about it really, but you will have these slides to look back on and have a further think about whether this is the right course for you. This slide is really just to reinforce what Kelly said. So do follow through with going onto that website. Now, what we were going to do is just open up the floor to Q&A. So if you just wanted to pop any questions that you had into the Q&A box, that would be fantastic.
As I mentioned before, I'm more than happy. There we go. Great question. I'm more than happy to email me later on if you've got a question, but here's a couple now.
Oh, yes, here we go. So Lauren, can you comment on whether there are application questions for the application? Now, Lauren, are you talking about the Mid-Start application?
I can answer that. That's generally what people are asking. What we do have in the handbook are criteria for application, or both. There you go. So I can talk to Mid-Start. So we've got 6 criteria. Let me just double check. You know, I should know that off by heart. Yes, there are 6 criteria questions. Have a very good look at those questions, because the criteria selection, because that is what the questions will be based on at your interview. So that is on page 8. And there's the selection criteria. There's 6 of them in a beautiful pink little box. Have a very good look at those. That's what you'll need to respond to in your application, in your Mid-Start application, and they will be what the interview questions are based on.
And from the UTS perspective, we don't have application questions, so we don't do interviews. It's literally taken off your application, very basic sort of demographic stuff that you answer and apply for, very similar to what you would have done with nursing. And then we're really just waiting for that letter of contract of employment.
A few questions in the Q&A as well. Lauren says thank you, firstly. First question is from Elo, or Elo, sorry. Hopefully I'm saying that right. How many students will UTS be taking for the course per year, I guess?
Yeah, so we can take up to 75. So this year we've got 69, and you know, we're always got more people than we can take. So our places are very much restricted to the clinical placement. So we have to have the clinical placements before we can offer university. So at the moment that is set at 75, and as Kelly said, it's very competitive.
Great. Next question is from Laura. How many women do we need to follow over the 14 months for our continuity of care experiences? Thank you.
Now there's someone who has some inside information. So it is 10 women. So a little bit luckier than the undergraduate course who have to follow 20, but they do have 3 years to do that. So in the postgraduate course, it is only 10.
Does following 10 women mean we could be on call throughout the whole year?
So Grace, yes, when you do your follow through with your women, yes, you will be on call for those women. So we currently expect that you won't be able to attend all of the births, but we would like you to attend at least 5 of those births. So it's about really how you organise your life, really. But generally speaking, most students will have 5 per semester. And it's a bit of a trick of, picking women who have had babies before and women who are having their first baby. And and that will, that helps make your life a little bit easier. But we talk you through all the little tips and tricks so that you don't feel like you're spending 14 months on call.
Just to echo what, there's another question from Isabel. But just to echo what Loretta and Kelly have both said prior, is that on the next slide, there's actually contact details for Loretta, and I can send through Kelly's contact details when I email you the slides as well. Just if any questions pop into your mind post the info session, feel free to send those questions through to either Loretta or Kelly as well. But we do have one more question here. When does the autumn session start? So I'll give that to you, Loretta.
Okay, so the autumn session will start in sort of late January. So we will start the pre-semester in December. So that's pretty much an online course. And then at the end of January, we start Midwifery Boot Camp. And that's really the beginning of our autumn. And you come into university for about 6 days, and we go through all of the skills that need to get you up and running as a midwife. And then after those first couple of weeks, so we're talking the end of January, the first week, the first 1 to 2 weeks, the first half of February, really, we have those boot camp days. And then after that, it's every Thursday. And we're just coming up to the we're about week 8, I think, in the semester now. And so towards the end of May, early June is when we're tying up our semester here for autumn.
Thanks, Loretta. And a question from Lauren. Can you describe what time requirements are required in addition to the 4 days work?
If you're talking about study requirements, so we would expect that you're going to have about 3 hours per subject to get through the material, and then you'll probably need another 3 hours for the reading and pre-learning. So you're only going to be doing, once we go to that every Thursday, you do 1 subject per Thursday. So you'll be looking at about 6 hours of extra time that you'll need per week to make sure that you're on top of all your assessments and work. At a minimum. It's a really, I'm not going to lie, it's a really tough year because you are working and you're learning at the same time. And you will have come from, being the registered nurse that's very autonomous and able to just get on and do stuff, to a student. And it is really, really tough and when you're learning, but we do have some great support here for you. And we're very, we have tailored the course so that we're making it as easy for you to study and work at the same time by giving you that blended and hybrid learning. And as I said, we do things like case studies and group work. So there's not going to be a lot of didactic teaching and things that you're going to have to rote learn. That's not how we do things. That is not the best way to learn. So it's very experiential learning that you'll be doing in your clinical placement, and we will be putting in place at university the foundations for you to do that.
Great. A question from Grace. Will we be in UTS uniform whilst working in the ward 4 days a week, or in New South Wales Health uniform?
You'll be in New South Wales Health uniform because you will be employed, paid by them. And when you come into university, you can wear, I'm not going to say whatever you like because there is appropriate. So when we're doing lab work, you have to wear closed-in shoes. Wouldn't expect that you'd be wearing a midriff top. So you need to come smart, casual, but PPE attired, so that where you're safe to do work around some of the stuff we have in the lab.
And I can answer a little bit more about the employed component. So one of the questions that we quite often get is what rate will you be paid at? So it's whatever rate you're at as a registered nurse currently. So say you're second year RN, then you'll be paid second year RN, or going into third year, then third year, and so on. So your rate of employment is the same as what you are now, or what you would be if you were working as a registered nurse. That is an important thing. You are still a registered nurse, so you are employed as a registered nurse who is studying midwifery, so midwifery student, but you're an employee. And when you'll be expected to start working at the hospital, that depends on which hospital you are successful at getting a position. They tend to start at the end of January. Some wait until the beginning of February, but that will very much be dependent on the local health district and the hospital that you're successful at getting a position. But that information will be in your contract letter. Generally, it's around the beginning of the year.
And before we do leave, I would like to thank Loretta and Kelly for delivering the presentation. Thank you very much. And extend a thank you to all of you for attending as well and being with us tonight.
Well, I'm just going to say thank you, Loretta and James, and for inviting me to come and talk to the potential midwifery workforce that we've got in the future. And yeah, as I mentioned before, very rewarding profession to be in, so would highly recommend it.
Absolutely, and I look forward to seeing you here at UTS. UTS is a great choice for your university, and if you do have any further questions, please don't hesitate to email me and make contact with UTS for any other inquiries.
Okay, looks like we'll call it there then. Thanks again to Loretta and Kelly. Thank you all for attending, and I hope you have a great evening, and reach out to us if you have any more questions. Thanks, everyone.
Thanks, everyone. Good night.
Thank you.
Bye-bye.